Hey everybody, welcome back to Drug Talk. As always, I'm your host, Garrett Campbell. Today we're going to be discussing a medication known as Cariprazine. Its brand name is Vraylar. And before I talk about the medication itself, just keep in mind that this channel is for information purposes only and not to be used as a source for recommendations for your personal health care. And quickly, if any time during this video you find this information to be valuable, please consider leaving a like on the video as it would really help me with the YouTube algorithm. So first, what will we cover in this presentation? We'll start by talking about how cariprazine works. We'll then discuss indications or reasons we would prescribe this medication to a patient, followed by contraindications or reasons we would not be able to prescribe cariprazine. We'll then discuss examples of dosing, and then stick around to the end where we'll talk about side effects with percentages. So how does cariprazine work? Well, cariprazine is an atypical antipsychotic medication. It is a partial agonist at serotonin 5-HT1A and dopamine D2 receptors. Also, it is an antagonist at serotonin 5-HT2A receptors. In terms of indications or reasons we would prescribe this medication to a patient, we may see it used in the treatment of mixed or manic episodes associated with bipolar I disorder, and it can also be used to treat schizophrenia. With respect to contraindications or reasons we would not be able to prescribe cariprazine, we just wouldn't give this medication to a patient who had a hypersensitivity to cariprazine or any other component of the formulation. Now what about dosing with cariprazine? So in bipolar disorder, the initial dose would typically be 1.5 milligrams orally once daily on day 1. The patient may then increase the dose to 3 milligrams once daily on day 2, and may further adjust the dose in increments of 1.5 to 3 milligrams. The typical maintenance dose would be 3 to 6 milligrams once daily, and the maximum dose would be that 6 milligrams per day. In schizophrenia, the dosing would be similar to bipolar I disorder, but the maintenance dose this time can be 1.5 to 6 milligrams once daily, rather than 3 to 6. Now, as with all medications, there are some side effects or adverse reactions that patients may experience while using cariprazine, so I'll go over some of those here now. 4 to 7% of patients may experience indigestion, while vomiting may occur 4 to 10% of the time. 9 to 20% may experience akathisia, and 5 to 8% may experience somnolence. 4 to 7% may experience restlessness. Now, some more rare but serious side effects would be hyperglycemia or high blood sugar, seizure, or body temperature dysregulation. That's all we're going to talk about today with cariprazine or Vraylar. As always, I'm very thankful you took the time to come by and watch one of my videos. If you found the information valuable and you'd like to help grow this channel, you can like the videos, share the videos, or most importantly, subscribe to the YouTube channel. There's also some links in the description you can check out as well. So for today, take care.